If you would like to appear on an episode of My Story Living with Lupus, you can contact us at mystorylivingwithlupus@gmail.com. Also visit us on our Instagram page and also our website, My Story Living with Lupus. The views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved. Thank you for joining me for another episode of My Story Living with Lupus podcast. I'm your host, Susan Hendrix, and I'm so glad that you could join me on this Friday, October 30th, 2020. Today's episode is about algorithm and how it blocked kidney transplants to Black patients. That's right. So, you know what I want you to do, all the way from the United States to Japan. Grab your cup of coffee, your cup of tea, and to my listeners late at night, you know I appreciate you. So, grab your favorite glass of wine and join the conversation right here on My Story Living with Lupus podcast. We all know the benefits of apple cider vinegar. Now, you guys know that I'm a vegan and that I have lupus along with other health issues. I used to take ACV every morning before I worked out, but eventually the taste of ACV got to me and I had to look for another alternative. And that's when a friend of mine turned me on to Goalie. Goalie is the first apple cider vinegar gummy. They give you all the benefits of ACV without the taste. That's right. Goalie is vegan, gelatin-free, gluten-free, and 100% organic. And the vitamins and the ACV in Goalie promotes a healthy heart by maintaining a healthy cholesterol range, controls blood sugar levels, and also curbs your appetite. And the best part about Goalie, for every cell generated, a child in need receives a 6-month supply of essential vitamins with Vitamin Angels. So, if you don't believe what I'm saying, I'm going to give you some information so you can try Goalie for yourself. Here's a promo code you can use. It's SUELYN1. That's SUELYN1. GOYNNE1, and you'll receive 5% off of your initial purchase. Also, I'll leave a link in the description in the podcast. So, why don't you go and try it for yourself? You won't believe how good it tastes. That's Goalie. You know, if you reflect on my previous episodes where I talked about discrimination within the medical field towards people of color, especially people of African American descent, I'm talking about blacks. Did you know that African Americans are almost 4 times as likely as whites to develop kidney failure? While African Americans make up about 13% of the population, we account for 35% of the people with kidney failure in the United States. And that brings me now to this algorithm blocking kidney transplants to black patients. Now, let's talk about what is a medical algorithm. A medical algorithm is any computation, formula, statistical survey, or lookup table useful in healthcare. Medical algorithm include decision trees, approaches to healthcare treatment. Example, if symptoms A, B, and C are evident, then use X treatment. Also, a medical prescription is also a type of an algorithm. But how can it block patients from receiving a kidney transplant? And this is the question. It is a well-known fact that blacks suffer from chronic diseases and receive inferior health care relative to our white counterparts. Racially skewed math can make the problem worse. Doctors often make life-changing decisions about patients' care based on, you got it, algorithms that interpret test results or weight risk. So I want you to stay with me. And when I return, I will tell you more about how algorithms blocked kidney transplants black patients when we return. The Charlie E. and Minnie P. Hendrix Foundation for Chronic Illness Awareness, giving hope and empowering those who suffer with chronic illness. See one, reach one, educate one to empower the masses. You can contact the foundation at 313 303-9217 or visit their website at https://cemphfoundation.com. This is a 501c3 organization. No one should live in lack. All contributions are tax deductible. I want to tell you about some research I found about how an algorithm blocked kidney transplants to Black patients. Now, it states a formula for assessing the gravity of kidney disease is one of many that is adjusted by race. The practice can exacerbate health disparities. Now, Black people in the United States, as I stated previously, suffer more from chronic diseases and receive inferior health care relative to white people. Racially skewed math can make the problem worse. Doctors often make life-changing decisions about patients' care based on, you got it, algorithms that interpret test results or weight risk, like whether to perform a particular procedure. Some of those formulas factor in a person's race, meaning patients' skin color can affect access to care. This is nothing new, my people. If you like I state, go back to previous episodes where I discussed the bias that exists within the medical field regarding Black patients. Now, a new study of patients in the Boston area is one of the first to document the harm that can cause. It examined the effect on care of a widely used but controversial formula for estimating kidney function that by design assigns Black people healthier scores. The study analyzed health records for 57,000 people with chronic kidney disease from the Mass General Brigham Health System that includes Harvard Teaching Hospitals, Massachusetts General, and Brigham and Women's. 1/3 of Black patients, more than 700 people, would have been placed into a more severe category of kidney disease if their kidney function had been estimated using the same formula as for white patients. Now, don't we all, if you cut us, and I know you've heard this saying, don't we all bleed the same color? And I have told you guys, I have got put out so many college classrooms because stuff like this really ticks me off. What makes one person's health more important than another's, where you would overlook, but you are the same ones who took that Hippocratic oath to do no harm. I'm sorry, I digress, but stuff like this, let's get back to it. All right, the same formula as for white patients that could have affected decisions such as when to refer someone to a kidney specialist or refer them for a kidney transplant. In 64 cases, patients' recalculated scores would have qualified them for a kidney transplant wait list. None had been referred or evaluated for a transplant, suggesting that doctors did not question the race based on recommendations. That was really staggering, stated Malika Mendu, an assistant professor at Harvard Medical School and kidney specialist at Brigham and Women's, whose work on the study convinced her to stop using the race-based calculation with her own patients. We know there are already other disparities in access to care and management of the condition. That is not helping, quote unquote. So if you think that you can go into a physician's office and not think that your race is not coming into play, my dear, you better think again, because it is. The kidney algorithm, by contrast, is one of the many clinical decision algorithms that explicitly take account of race. A recent review listed more than a dozen such tools in areas including cancer and lung care. Now, in August, a group of Black retired NFL players sued the league, claiming it used an algorithm that assumes white people have higher cognitive function to decide compensation for brain injuries. The issue is winning more attention, including from federal lawmakers. Now, many clinical algorithms can result in delayed or inaccurate diagnosis for Black and Latino patients, leading to lower quality care and worse health outcomes. The new study examined a standard calculation called CKD-EPI used to convert a blood test for a person's level of the waste product creatinine into a measure of kidney function called estimated glomerular filtration rate, better known as EGFR. Lower scores indicate worse kidney function. The scores are used to categorize the severity of a person's disease and guide what care they receive. Now, if you look at some of your lab work and you find either GFR or EGFR, I want you to think about what I just stated and what I read to you, okay, about the algorithms. Okay, the equation factors in a person's age and sex. Black patients get their score boosted by an additional 15.9%. Now, that design is coming under fire from academics and medical residents who fear it bakes discrimination into kidney care. And it does. Researchers who created the formula back in 2009 added the race correction to smooth out statistical differences between small number of Black patients and others in their data. When we return, we'll discuss it even more, so stay with me. You know, those of us with lupus experience hair loss, thinning hair, either from the illness or the medication we take. I have this perfect solution for you. It's called VITALIZE. Yes, VITALIZE can help you. They are in the business of growing healthy hair. They have a hair system that can help you, and even better, they have a new and improved edge control gel. That's right, ladies. There is no flaking. It lays down the edges and also protects it from heat. But wait 1 minute. Most importantly, the edge control has the award-winning hair growth ingredient retin sol. Addition to the 3-part scalp treatment system, there is a silk pillowcase for you to lay those growing locks on. Shampoo, conditioner, and multivitamin gummies. You can see reduced shedding in 2 weeks. You heard me. And most see results in 4. To see proof for yourself, go on over to vitalizehair.com. That's VITALIZEHAIR.com and use the referral link listed in the information box on this podcast. All right, thank you for joining me back. Let's complete this because I want to tell you how my visit with the endocrinologist went. Now look, a preliminary version of the newly published findings helped convince leaders at Mass General Brigham to abandon the race-based EGFR formula. In June, several major hospitals, including University of Washington and Vanderbilt, have done the same this year. Support is growing for an alternative method of calculating EGFR that uses a different blood test for the protein cystatin C. Now, despite those shifts, the campaign to remove race as a factor in kidney assessment and care has a long way to go. Many institutions and doctors are unlikely to move away from the traditional calculation unless medical societies changed their guidelines. The two leading U.S. kidney care organizations have formed a task force on the issue. More than 1,300 people have signed a petition urging that group to act. Vanessa Grubbs, the co-author of the petition, an associate professor at UC San Francisco, says adjusting equations is only part of the work needed to undo the harms of using race in medical formulas. After institutions change their EGFR calculations, they should also review Black patients' care plans, how they train new doctors, and how they think about race. Equations with race baked in encourage doctors to categorize all patients racially, she states, distracting from their true medical needs. Black people aren't the only ones affected, she stated. This is bad for everyone. Now, it took this long for them to come to this conclusion about judging a person's race within the medical field. Now, if you think I should say, what I have been telling you I've been in the medical field. I was in the medical field for 30 plus years. If you think this stuff did not happen, it happens every day. That's why I tell you not to sit back and just agree and go, whatever you say. You are your own best advocate. We still live in a society where race is played in every situation in life. It's time that you wake up, open your ears, and open that third eye and speak up. Research. Do your research, people. It is so very important that you do your research. Now, when I return, I'll tell you how my office visit went with my endocrinologist, so stay with me. Okay, there's several things I want to tell you guys before I get to my visit with the endocrinologist. Number one, the Charlie E. and Minnie P. Hendrix Foundation, the foundation I formed in honor of my parents to help those who are suffering with chronic illness, is doing a Christmas giveaway. First is for the ladies, and also you can be in the LGBTQ community. I don't mean to get that wrong, but if you're within the community, let me put it that way, because we don't discriminate. You have a chance if you suffer from a chronic illness or you're experiencing hair loss, be it from lupus, cancer, alopecia, whatever it may be from your chronic illness, you have a chance to receive a human hair lace frontal unit All you have to do is send in a letter stating why you want this unit to info@CEMPHfoundation.com. And for the men, we always do something for the women, but this is for the men. We are giving away a $50 Visa gift card for Christmas. If you suffer from a chronic illness, all you have to do is send me a letter and tell me why you want it, why you deserve it, at info@CEMPHfoundation.com, and I want you to use the hashtag Visa gift card. And ladies, use the hashtag lace frontal unit. All right. As you know, coming up next Sunday, the foundation will be feeding and providing clothing to the homeless. As my mother used to tell me when I came home from high school, she used to ask me this question: what have you done today to help a needed soul along the way? And that has stuck with me for all these years. So we will be feeding and clothing the homeless in the metropolitan Detroit area. And I will be masked up, right, hitting the streets right out with my colleagues who have volunteered to help me do this. Also, I have been a little under the weather. I have experienced a lupus flare and a flare up with my fibromyalgia. This all went down on Friday, and the pain hit me so hard. But I had to get up Monday and go to my cardiologist, and my cardiologist seen me, and he said, "Susan, I have never seen you in this much pain. Let me call your rheumatologist to see if I can get you in earlier." So, I'm okay, and I have an appointment with the rheumatologist on the 4th, but I had a doctor's appointment at my cardiologist on Monday, another doctor's appointment on Tuesday, and then on Thursday, it brings me to the endocrinologist. And here we go. The nodules and cysts have grown, she said, less than a centimeter. Cysts are sac filled with fluid, and we know that sometimes those fluid filled sacs can consist of cancerous material. But as I told my endocrinologist, we're not claiming it. My blood work is a little disarray. My thyroid is enlarged, but by his stripes, I am healed. I'm not going to worry about that. All I did when she told me was, I asked my questions and what was the next move. So I need to go see my oncologist to have some labs done. I see another physician on the 10th, but I have another doctor's appointment on the 4th. So I am good. I had a talk with God and I said, okay, you know what you placed in my heart to do for those who are in need. And I said, if you just let me complete this task on the 8th, then I'll see about myself. So I'm feeling well enough to do what I have to do on the 8th. And I will complete that. Let me get a sip of water. Ooh. All right. I have so many doctor's appointments, and I can understand that they want to get everything in now before we hit, the virus has already hit. It's on a rise here in Michigan, and I don't plan to be going out to any doctor's appointments. I don't plan on having any operations anytime soon. I told the doctors, it will wait. I'm not concerned. It will wait till things get better. All right. So we know how I do it. I laid it on the altar and I'm leaving it there because I know that God has my back no matter what I go through in my health. But that is it with what is going on with my health. But I want to leave everybody with this, and it's about forgiving. The grace to forgive comes from God. The decision to forgive is ours. And what a harvest of this fruit of the Spirit for others as well as for ourselves. Eternity will hinge on it. You get that? The grace to forgive comes from God. The decision to forgive is ours. And what a harvest of this fruit of the Spirit for others as well as for ourselves. Eternity may hinge on it. I'm Susan Hendrix for my story, Living with Lupus podcast. I'll see you next week for another episode. Please have a safe, blessed, and oh so peaceful weekend. The views views and opinions expressed on My Story Living with Lupus podcast represents each person's individual experience. By listening to this podcast or reading our blog, you agree not to use this podcast or blog as medical advice to treat any medical condition in either yourself or others. As always, consult your own physician for any medical issues that you may be having. My Story Living with Lupus podcast is officially trademarked, all rights reserved.